When we faced COVID starting last year, I think at our second, it must have been our second National Emergency Response Committee, I was then challenged about the supply of medical commodities in Kenya. And I remember coming out of the meeting, it was in Harambee House, and I then challenged industry to supply these things within a short time because we could no longer import them. Planes had stopped flying, ships were delaying, people who make these things were sick in their countries, and we were wondering what would happen if the predictions from the Ministry of Health came true that we would have nearly 10,000 people ill by the middle of April last year. One of the exciting things for us is that the response from local industry was actually instantaneous. These things we are wearing these days, these masks, part of the reason why you hear a lot about it in the KEMSA probe is that we were not making them. And we knew we needed them. So many people started to stockpile very quickly. But in Kenya, our industries started to make them. And in no time, they had supplied from an original price of maybe 200 or 300 shillings in some cases. For the medical ones, for the N95s, it was actually about 1,000. These prices have come down to about 10 shillings or less for this mask because we are making them. And that's something we really want to celebrate in the country. The beds that have been done by Gadogo and friends, it's an exciting demonstration of our capacity to make things that we have often imported.